We have heard reports of colleagues being infected who are being treated in intensive care units. So it's important that we provide appropriate protection for these colleagues, and all our trainees and ourselves in the front line need enhanced protection, both for the medical professional and for the patients, because it's a two-way process. We don't want to spread it in the community too. There is evidence that there are two types of exposure. One is an intense viral exposure in a very heavily infected patient, as was seen in the SARS epidemic in Toronto a few years ago, where the persons on the front line who were putting the tubes in intensive care units without protection got seriously ill. It did not matter how fit and well they were. You may have a low-level exposure on a daily basis is something that can be of concern. And until we know more about this COVID-19 pandemic, we need to protect our frontline staff, our trainees, with good masks. Immunity is best when you are well rested, you're well fed, and you're not exhausted. Evidence from China and Italy is clear that medical professionals need good protection, and at the same time they need to have their health looked after, first of all by themselves, but also by the hospitals and authorities to allow them to get that rest and relaxation. We have learned one important lesson. Singapore, of course, they provided good protection right at the outset for all their medical professionals, and they had almost a 0% healthcare workers being infected. So it is protection essential, Prime Minister, please, because our healthcare staff are vital for the health of the rest of the population.